Type 2 diabetes is by far the most common type of diabetes. In most people, there are two factors involved in the development of type 2 diabetes. First, the body becomes resistant to the effect of insulin. So the pancreas has to secrete more and more insulin to keep blood glucose levels normal. Over time, the pancreas can no longer keep up, and you develop diabetes. Let's take a closer look. When a person with type 2 diabetes eats something, whether it's a salad, a soda, or a sandwich, the food begins its normal journey into the digestive system. When it reaches the small intestine, it's broken down into all kinds of nutrients, including glucose, which are absorbed into the bloodstream. Now, at this point, things get a little tricky. The pancreas does actually do its job and produce insulin, but the insulin isn't working well enough to allow the glucose out of the bloodstream and into the body's cells, where it can be used as fuel. And as a result, the unused glucose builds up in the bloodstream, and the blood glucose levels in the body start to rise. Having high blood glucose levels can make you feel weak and tired. Sometimes you might notice that your vision gets blurry, but many people don't notice any symptoms at all. In fact, type 2 diabetes is often diagnosed during a routine checkup. If you've been diagnosed with type 2 diabetes, it's time to take action. Since your body's insulin isn't able to do its job, you need to help it out. To figure out exactly what you should be doing, talk to your healthcare provider. While you're there, you may want to ask whether there are opportunities to meet with a diabetes educator, either as part of a group or one-on-one. Your recommended treatment plan will probably include getting more exercise and trying to lose some weight. And your healthcare team might also have you try things like changing your eating habits and counting the carbohydrate value of the foods you eat. Your doctor might prescribe medication that can help lower your blood glucose levels. Some you take by mouth. Other medications are injected just under the skin. Most people with type 2 diabetes take more than one blood glucose lowering medication, especially if your blood glucose has been high for many years. Your team might also have you test your blood glucose levels so you can see how you're doing. Tracking your numbers helps you notice trends, so you can make appropriate adjustments to your treatment plan. Living with type 2 diabetes does mean making some lifestyle changes, but they may not be as difficult as you think. Find the people who could advise, encourage, and support you. And remember, HealthSimple is here to help.